a lot of people that I work in the inpatient setting, and we still need those skills. We still, I mean, a lot of times you can prioritize the medical things, but every patient that you come in contact with you need to have a rapport with them. And I feel like that's a huge strength in psych nursing, like being able to foster those skills. I mean, those are nursing skills. They're like soft skills, but they're soft skills that we use every single day.
Yeah.
So I think I feel like I've learned in this episode, that's like a huge, you should never have a chip on your shoulder for not needing to do, IVs and stuff. You're such an important, position.
Yeah. Thank you. I appreciate you saying that. And I liked what you and Shannon were talking about kind of some of the aspects of nursing that, once you have your skill base and you have that built, but some of the things that are really special are, holding people's hands, being part of people's families, things like that. So I think that's one of the really, really special things about nursing, the art and the science kind of blended together.
Mm-hmm.
Yeah. And then one other thing that I was kind of thinking about is I was, when I started out in nursing, I think I was just so excited. Like I had done all the schoolwork, I passed my boards. I just had so many nurses and so many people that I looked up to that I wanted to be. And so I would take every extra assignment, difficult patient, great, give it to me. An extra assessment, I'm fine. Yeah, I'll give your meds for you. And I was just going because every code, I'll lead this code, I'll de-escalate this patient, like I'll do this. And I was driving to work one day and I was talking to my mom, who is one of my mentors and also my hero. And she was telling me about how I was like, Mom, I can't do today. I don't know what I'm going to do. I have to go in like 10 minutes and I can't do it. And she was like, put on your armor. It's okay to feel vulnerable, and it's okay to just put on a little bit of armor and to not be the super nurse running around. It's okay to just get through the day. Mm-hmm. And that is something that I have taken with me always, and something that I have, as I've gotten further in my career, really kind of tried to make a point to do is I don't have to be the one to respond to this code. I can take a kind of supportive role. And I realized too that I feel like that almost makes me kind of better to work with, because I'm giving other nurses the opportunity to grow their skills and to be the one to, share their opinions. And instead of me kind of, tirading around, I'm, being more of a team. And, too, I think when it comes to de-escalating patients or just working in nursing in general, you can feel like you're hitting your head into this wall, and to take a step back feels like you failed. And that's not necessarily the case. If you're trying to de-escalate this person, trying to de-escalate them, and it's not working, you might just be agitating them. You know what I mean? And that's nothing about you.
You might not be the person.
Exactly. And that's not you personally or anything. It's just, it's not you failing. It's almost you kind of reaching a higher level, I feel like, of assessment and clinical judgment and saying, okay, I'm not helping this person, so I need to step away.
Yeah, I totally agree. Like understanding, like, okay, I think I need to remove myself from the situation. I think leaving space for yourself to be a human, and also leaving space for other people to, increase their own skills by stepping away. I think that that's definitely a heightened level of awareness, like self-awareness, that I'm sure can only benefit you.